relax. The whole universe is inside of you. It was a normal day. I was going to play basketball where I work and teach yoga. My teammate passed me the ball and I couldn't get it with my right hand. I tried to get it with my hand, I couldn't. They were like laughing at me, what's wrong, what's going on? I couldn't say anything. And I went over to the wall. I kind of went down the side and losing my right leg and my right arm. That whole side was starting to go down. I couldn't speak. I couldn't do anything. I just waited for the ambulance. They got me to the hospital right before I passed out. I got off the ambulance and I got in the emergency room, and then that's about all I know.
I met Aaron 6 p.m. on a Friday. I was trying to leave the hospital and I heard overhead that there was a code stroke. It says that it's a LAMS of 5, which means a severe stroke. I thought, I better go eyeball this guy before I go. And you look at him and he's this handsome guy with 10% body fat who's like less than 40 years old and not our typical stroke patient. He'd come straight from the basketball court, completely aphasic, couldn't speak, couldn't understand speech, totally paralyzed on the right side. His gaze were pinned over to the left, and he was blind in the right side of his vision. Raised him to imaging and found that he had an occlusion of the top of his internal carotid artery on the left. He got a clot-busting drug called Tenecteplase, and we raced him to the cath lab. It was actually very difficult to open the artery. It required me to place a stent into the artery to restore blood flow. Right after we restored blood flow for Aaron, he was fully strong again. He could move his right side, he got his vision back, his gaze came back to midline, he could look around, but he couldn't talk. He's gonna really be in rough shape if he can't talk. He's not gonna be able to work, he's not gonna be able to do his vocation, he's not gonna be able to live his life. We actually have a trial where we can infuse these stem cells into the MCA, into the brain territory to hopefully restore some of that function. This is a trial that's run at only 5 sites across the planet. There have been 6 patients enrolled in the stem cell trial on the planet, and 3 of them have been here at Little Company.
Dr. Tarpley said it to my brother, and he said, if this stem cell gives him 60%, over 50%, wouldn't you want that? He's like, yeah. And he's like, this is what I'm trying to do. I'm trying to get people to get back to normal.
Aaron was a good candidate for the trial. He actually started talking shortly after the infusion, which you may think was too early to be explained by the infusion of stem cells, but that's actually what we would expect to see actually quite early. He's doing amazing. I think the way that we're going to continue to lead the pack and continue to be the best center possible is with philanthropy support.
I'm really appreciated for them taking care of me. Dr. Tarpley was always calling me, or his nurses were texting me, and it was really nice. Now I feel like I can do anything, anytime. I'm 8 months out now. For me, is be more of a listener than a talker. The more I could talk, the least I wanted to talk. I'm in a more graceful area. I'm much more blessed and grateful than before. And I hope to keep going on that path.